Southern Plains Medical Center presents your hometown medical minute, and your host, Hal Brock. Hey everybody, and welcome to our show, your hometown medical minute. I'm your host, Hal Brock, and with me, as always, behind the cameras, our IT director, Mr. Ed Harrison.
Hey Hal, how you doing today?
Ed, doing wonderful, man. It's been a great week here at Southern Plains. Of course, I'm always humbled. Every day I get to come to work here, and I get to see our amazing staff loving and caring for our friends, our neighbors, our community members who are sick and injured. I'm telling you, it takes a very special person to be a nurse, to be a healthcare provider, and it just amazes me how wonderful our staff is here. So Ed, it's been kind of a weird weather week. Of course, we've gotten a little bit more rain this week, and then the in-between times, it's been hot and it's been muggy. They're telling me though, Ed, they're telling me I can't complain.
I probably need to wait till August or September to complain.
Yeah, that's what they said. Well, and then they said that, and then they said because I complained too much when it was cold, they said I've lost my rights to complain when it's hot until it's mid-August, September. So I'm going to try to refrain, but I'm telling you, 70, Ed, that's where I live comfortably. You know, it's not too hot, it's not too cold. That's Hal temperature. Okay, we have got a great show for everybody today. We're actually going to make a trip over to our Anadarko clinic and talking to one of our nurse practitioners there, Jennifer Dorsey. Jennifer has been with Southern Plains for the past few years, has won multiple Mid-Level Provider of the Year awards for Southern Plains. She can literally help you guys with anything primary care or family practice related, but today we're going to be talking about something else because Jennifer is also our area's only certified BioTe Natural Hormone Therapy providers. Ed, we've all seen the commercial, right? Are you living your best life? Well, today she's going to tell us how we can live our best life and how to get started. But first, we got to get from SPMC Chickasha all the way over to SPMC Anadarko, about a 20-minute drive. I'll drive, so come on, hop in, and let's go. So hey, thank you guys so much for taking that little adventure over here to Anadarko with us. I'm here with our wonderful provider, Jennifer Dorsey. So, but first, what we kind of like to do here is I want everybody to get to kind of meet our providers. So if you wouldn't mind, just tell us a little bit about how you got into medicine and what brought you to Southern Plains.
Okay. Whenever I was young, growing up, my mom was a nurse. Okay. And it still is. She's been a nurse for 42 years now at the same hospital in Tulsa.
That's amazing.
And so seeing her take care of patients, she involved me in a lot, probably more care than I probably need to be around, or now that you can be around, but right. I was able to go do like home health visits with her, go work in labor and delivery with her and watch her, even as like a young kid. And so since then I saw her, taking care of patients and the impact that she had on their lives. And so I kind of had decided then that I really wanted to, and it intrigued me, and to be able to kind of figure out something that I could have joy with in my life like she did, and feel blessed to be able to take care of other people with. So then when I went to nursing school, I really wanted to focus on rural health. Okay. And so that was before I met my husband. And so then when we met and I moved down here, I just knew that was perfect. I mean, it was like
That was
all
what
God's
you
plan.
wanted to do.
Yeah, it was laid out, and I knew that that was where I really wanted to be. And so when I went to nurse practitioner school, then I really wanted to focus on being here. So
That's amazing.
so then it all played out.
I often say, I mean, nurses to me, that's the greatest profession I can think of. I mean, the amount of care that you have to be a nurse is simply amazing.
You know, treat people like it's your family. If you wouldn't want your family to be treated that way, don't do that to somebody. Don't treat somebody like that. And so I always try to put that into my life and try to into my practice and make sure that I'm treating people like I would want my family member to be treated. So
That's such great
really,
advice.
yeah.
You are actually the only provider in our area that does a natural hormone therapy. And I see the commercials all the time. And I gotta tell you, I don't exactly know 100%
Right.
what it is. So could you tell us a little bit about BioTe medicine?
It's an approach that really looks at more of a natural basis on replacing hormones, but also looking at the thyroid a different way, looking at different vitamins like vitamin D, B12, making sure that we're not having any kind of crazy anemia going on. So it's to be less technical.
Yeah,
I
okay,
guess.
cool. Yeah, for me that's perfect.
To be less technical.
Yes, yeah.
It's a pellet therapy. The pellet is actually made out of a yam, which sounds
Really?
kind of funny. Yes, it
Okay.
sounds kind of funny, but the molecules in
Sounds
that
natural.
Right.
Okay.
The molecules in that yam are very close to the molecules in our body that carry things.
Really?
So that's how they impregnate it with the testosterone and or estrogen. And
Okay.
then we put it into your body anywhere there's fat tissue. In a little bitty procedure that doesn't take, women it takes probably 5 minutes.
Okay.
Men are 5 to 10 minutes, depending on the amount of pellets, because they may get more pellets. And then our body puts a scar tissue, just like if you had a large splinter, and it puts capillaries to it to try to break it down. And as your heart beats, it just cycles through.
It just sits
24 hours a day, 7 days a week. You don't have the ups and downs like you do with injections.
Okay.
Sometimes people choose to do other, which is the synthetic prescription injections, creams, pills, patches. And those carry a lot more risk factors that we hear about in the media that's kind of scary. And but with the bioidentical kind is what the natural form is called. Then those are really eliminated, or they're really reduced.
For sure.
Because our body, we put something in our body and it says, hey, that's normal, it's natural. I'm going to reduce inflammation. Your joints are going to quit hurting. Those kind of things are going to really go down, and that's more of the benefit from it. And there's a lot more long-term health benefits as well, where we do synthetic injections, those things, you don't have as many long-term health benefits for replacing. So you'll hear people say, well, at a certain age you need to stop doing those hormones. But with bioidentical, there's no certain age to stop. It actually benefits you long-term to stay on it.
So natural hormone therapy, I mean, we see the commercials and it's typically targeted at a bit of an older population, but to my understanding, I mean, you start losing testosterone as a man at age 30.
Yeah.
I mean, and then it just progresses.
Right.
So I mean,
men and women.
Really?
And that's it. Yes, women.
Okay.
Testosterone is a huge. I feel like when I talk to my female patients, especially, that I really start harping on testosterone, they're like, but I don't understand, because estrogen is my hormone. But testosterone is, I term it the magic hormone. Not to make it sound like that type of way, but because it is what really controls our collagen production in our skin, our hair growth, like good hair growth. Women and men will both get male pattern baldness. We'll start having thinning hair, losing hair, weight gain, stress, anxiety, can't sleep at night, night sweats. And that's testosterone driven. And there's numerous others, joint pain, I don't know if I said that. Different things like that are due to inflammation from that being low. So sometimes we don't even, the majority of the time in women, I'd say 60-70%, we don't even have to replace any estrogen. It's just
the testosterone that's been depleted.
Right.
And so they started about 30, and you kind of mentioned the symptoms. What are indicators of those symptoms? Like, what should we look for when we're thinking about doing hormone therapy?
It's such a difficult thing because everybody experiences those symptoms differently. So I've had a couple men who were in their 60s and 70s who the primary issue was they couldn't finish 18 holes of golf without stopping, and they were just tired. And I've had women in their 20s and men, 20s and 30s, who a big issue with them is decreased sex drive and things like that that you think more that are driven with this hormone. I noticed after probably for sure my second child, that I really got extremely tired at night.
Yeah.
Like I mentioned, the hair growth, I had bald patches right here, which I thought was just my thyroid, but my thyroid was fixed and it wasn't going away. Like I said, extreme fatigue, really bad anxiety and agitation, to where I knew that something was up. I knew, and even my 8-year-old would tell me when he was 7 to 8 at the time, and
because he's been watching the change.
Right.
He's close to
and
you.
he would always just say, "Mom, I won't bother you because I know your head doesn't feel good." Because I didn't feel good, and so because I would really be agitated with him a lot of times because he was the older one, and so then I knew something was going on with me, and my husband even said, "You need to talk, figure something out because you're just agitated all the time." And it was right the week before I was going to training.
Really?
And so I went to the training,
Wow.
and it was like that first night I was on fire, couldn't even sleep because I was so excited that I was like,
Well, you found something for you.
This is
too.
me, yes,
Oh
this
my
is me. And I
gosh.
went into it thinking, oh, I don't need this.
Right.
When they had approached me, I said, well, I don't need that, but I'll go listen to it.
Okay.
And then I got there and I was like, I want it now. And it just made a huge, that was a Saturday to Tuesday, so the next day I could tell a huge difference in my energy, which I was one of the lucky ones. Sometimes it takes longer.
Right,
But
okay.
then by Tuesday, my little 8-year-old, he said, Mommy, you feel a lot better. And it still makes me emotional, but
No way.
he didn't know anything I'd done. He knew I went down to Dallas to do work.
To do the training.
And whatever.
Right.
So we initially start out, come in and do, you schedule a consultation, or you just, establish, and then we kind of figure out what are you here for. And then we do that, we draw the lab work, and then that takes about 2 days to get back in. I always tell people. So whatever their schedule is, I have them go ahead and schedule 2 days or longer, whatever works.
Right.
The labs are good for a year, so it's no rush.
Oh, okay.
But then they come back in, so we can just talk about it. I've had some who yes, their hormones were off, but their thyroid was horrifically off, and their vitamin D and their B12. So we fixed that first, and they felt great. So sometimes you don't even, just because you're having some of the symptoms, now there's some key symptoms.
Right.
Decreased sex drive, vaginal dryness, those kind of things are going to need to probably be fixed with hormones.
Right. Okay.
But some of the other things, if it's fatigue, I can't sleep at night, I'm having this sweaty, dry hair also, things like that, we may be able to fix it with that and not have to do that.
That's awesome knowing that there's options going into it.
And I'm really trying to look, I know a lot of clinic, and I'm not trying to say anything about it.
No.
A lot of them just, if you're there to do the hormones, that's what you're going to do. If other things are, they don't kind of get that option to do other things.
That's what they're there for.
But I try to do other things with it, and try to make sure that we're doing that, because it may save you some money, or it may save you not having to start that for another 2 years or something. You never know. But we do that, so we come back and talk about it.
Okay.
If some people are like adamant they're going to do the pellets, they want to, which is great.
Right,
then we go ahead and do them that day when you come back for the follow-up.
Okay.
So as long as all those labs are in, mammograms are done. That's one of the big things is females over 40 gotta have a mammogram.
Okay. Which you need one at that age anyway.
Right,
yes,
right. So
absolutely.
and I kind of go over preventative care too. So not just the BioTe stuff. We try to say,
That's awesome.
have you had your colonoscopy? Have you done this? Do you know skin cancer screenings and different stuff like that? Try to make sure that we're kind of fully caring for them.
Yes.
And then if we do the pellets, if we do the pellets, then like I said, it's a 5-minute procedure. We numb the area really good, either abdomen or the backside, or an arm. We can even do it.
Really? Okay.
I have a woman who really likes the arm, so we do that there. And then it's just a teeny tiny incision that we end up gluing shut at the end. And you have hardly any scar. And you also don't have, the big thing is if you look up synthetic testosterone, it really talks about hardening of arteries and cardiovascular disease and things like that. And there are a lot of studies that we can pull up about the bioidentical hormone replacement on testosterone that actually softens those vessels.
Really?
So long-term decreases dementia, cardiovascular disease, bone disease, all of that. And it's a really amazing thing, but it's not as prevalent because everybody thinks testosterone is testosterone.
Right.
But it's really the delivery method that's causing that. So that makes the big difference.
So after the initial round of pelleting, and you got like 4 to 6 months, you mentioned, then what happens next?
So we do that initial pelleting, and men come back in 4 weeks to check their lab work.
Okay.
I have some that if I see certain things kind of changing in it, I may have you come back a little bit more frequently.
Okay.
Like estrogen level is one thing we check in men because we can aromatize or metabolize our testosterone into estrogen.
Okay.
And so whenever that happens, and you hear of men who say, well, so-and-so got on testosterone and they have roid rage, it's that estrogen level getting way too high.
Wow,
and so we have to block that. So there are some men I have come in more frequently, but I have some who they come back at 4 weeks, they feel great, and all the lab work looks good. They don't have to come back until it's time to do their pellets again when they feel symptoms come back.
Okay.
So they may start feeling their joint pain, or they may get really tired.
Back to that feeling that they had before.
Exactly.
And now they're aware.
Exactly.
Right.
Yeah, hopefully.
So, yeah.
Or you will be. Once you start feeling like different, like things change, like I'm not sleeping well,
I bet.
my night sweats came back, within about a week to 2 weeks, it's going to just drop off. Come back and get it, because we want to bridge it.
Right.
So we do that, and then as long as they're feeling good, you just have to do them once a year. Have to recheck everything. Women are at 6 weeks, and kind of same thing. If thyroid dysfunctions or something like that changes in between, then we just have to more frequently check it. But other than that, I have people who come in, they know their dose, walk in, they say I'm ready, and we just get them back, and they're on their way. And
That's
so
super
it's
easy.
a very quick process once we get it going.
Well, we might be coming back. I might actually talk to you a little bit more in depth about this, because it sounds like something I might want to kind of peer into and see if it might be right for me. You can do the same thing this next Wednesday, June 12th, from 11 a.m. to 1 p.m. Cool 105.5 FM will be here at our Anadarko clinic. We're going to do a Anadarko health check. So really cool. It's kind of like a miniature health fair. We're going to be
Southern Plains Anadarko Family Medical Clinic teaming up with Cool 105.5 for a free summer health check. Wednesday, June the 12th from 11 to 1 at Dr. Belt's office, 1104 East Central, with free blood pressure, vital screening, free skin cancer screening from noon to 1. Register to win free BioTe labs, a $149 value. Nurses, providers on hand to provide information about SPMC Anadarko. Wednesday, June the 12th, 11 to 1 at 1104 East Central with Cool 105.5.
or not. I mean, this is an amazing event. Next Wednesday, June 12th, here in Anadarko, 1104 East Central Boulevard.